Good evening and welcome to NTD News. Here's today's top stories. The number of deaths from the CCP virus in the US surpasses Italy's, nearly 20,000, but our mortality rate remains very low. New York State's death toll is still in the 700s, but its hospitalization rate is down. A new study helps us better understand the CCP virus, how it's mutating, and how it's spread in the early stages. An urgent notice posted to social media says a Chinese province plans to add 52,000 quarantine rooms. And costume makers from hit TV shows like Downton Abbey and His Dark Materials are helping make scrubs for hospital workers in the UK. Today, the US has surpassed Italy's number of deaths from the CCP virus. But considering each country's population, our death rate is far lower than Italy's. NTD's Miguel Moreno has more.
On Saturday, the number of deaths from the CCP virus surpassed Italy's, nearly 20,000. But the mortality rate in the U.S. is far, far lower. In the United States, the virus's mortality rate is about 6 per 100,000. Italy's about 32. Dr. Birx from the Coronavirus Task Force gave credit to healthcare workers for keeping that number low.
As the president noted, our mortality in the United States is significantly less than many of the other countries when you correct them for our population. And that is really solely the work of our frontline healthcare providers.
President Trump also said they're expecting the final death toll to be far less than earlier projections showed.
So we'll see what it ends up being, but it looks like we're headed to a number substantially below the 100,000. That would be the low mark.
As of Saturday, the number of infections in the U.S. is over 519,000, but Dr. Birx said the epidemic curve looks like it's starting to level off for the first time. In light of the good news, the task force has given much credit to Americans for following social distancing orders. Miguel Moreno, NTD News.
And the White House today confirming an aid package for Italy. 30,000 U.S. troops will be mobilized to help build field hospitals and transport supplies. The U.S. will also send equipment to help fight the virus.
The Trump administration says it's preparing a robust aid package for virus-stricken Italy. The country is one of the worst hit, with almost 20,000 deaths. The help comes at the request of the Italian Prime Minister and will include equipment and supplies. Italy hosts around 30,000 U.S. military personnel. They will be mobilized to build field hospitals, treat non-virus patients, and transport supplies and food. NGOs, including faith-based organizations, which are already involved in the relief effort, will also be supported. Trump says the three goals of the package are 1. Lessening the risk of reinfection from Europe into the United States, 2. Maintaining critical supply chains and helping the Italian economy, and 3. Demonstrating United States leadership in the face of Chinese communist and Russian disinformation campaigns. The Chinese Communist regime has been trying to position itself as a global savior during the crisis, but its help for Italy has been called into question. What the Chinese regime said was a donation of medical supplies turned out to be a multi-million-dollar sale. Not only that, what Italy received was its own equipment donated to China at the height of its crisis. The U.S. Justice Department saying earlier this week the Chinese regime is using the pandemic to promote communism over Western liberal democracy.
And the plateau of hospitalizations continues in New York. Fewer people are being intubated. Governor Cuomo says it's a good sign, but New York City's mayor announced the city's schools will stay closed for the rest of the year. NTD's Melina Wisecup gives us an update.
New York may have reached the peak of the chaos. Governor Andrew Cuomo said the hospitalization rate is down. Even though there are still people getting infected and going to the hospital, it's less than before.
All the numbers are on the downward slope.
He called the decreasing number of intubations a hopeful sign, since people who are intubated are more likely to die. Yesterday, 783 people passed away from the CCP virus. Cuomo said it's unfortunate to still have such a high death toll, but noted that at least the number is stabilizing. And to protect New York City students, Mayor Bill de Blasio is keeping schools closed for the rest of the year. The decision comes after a conversation with Dr. Anthony Fauci, who supported the action.
The risk did not outweigh the reward.
He says students returning for only a few weeks wouldn't be effective, and that a rushed return wouldn't allow much time to properly clean schools. And the state, once asking for healthcare volunteers, is now asking for lawyer volunteers.
The New York State court system and our chief judge is going to organize lawyers statewide to do pro bono legal assistance.
It's to help people with housing issues or accessing government programs, since he says officials still aren't sure when the state will be able to fully reopen. Melina Weiskup, NTD News, New York.
And as the state's death toll now reaches over 8,600, Cuomo says the message from this year's Holy Week may be more precious than ever. And in Paris, with funeral homes overfilled, some nursing homes are forced to store the corpses of deceased virus patients.
A look at the number of cases and deaths in different countries around the world. France reported 600 new deaths in the past 24 hours. Russia's death toll remains relatively low at just over 100. This as the country is also fighting other issues. With Paris funeral homes swamped after a wave of virus deaths, bodies have been left to decompose in nursing homes. A spokesman confirmed that the number of deaths has risen to more than 21 in just one nursing home alone. In Moscow, dozens of ambulances lined up outside a hospital as they waited to drop off virus patients. One ambulance driver said he had stood idle for 15 hours to drop off a patient. And in order to prevent such a scenario, a city in eastern Russia is now using jet engines to spray disinfectant onto the streets. With Italy's death toll reaching almost 20,000, police are enforcing strict lockdown measures this Easter weekend. On Saturday, the only people seen in a park in Rome were policemen on horseback. And in Asia, the South Korean government decided last month that everyone arriving in the country after April 1st must self-quarantine for 2 weeks. Unfortunately, not everyone has respected the decision. Now the government will use electronic wristbands to monitor people who have been caught breaching the rule.
And a new study to help us better understand the CCP virus and its global spread. NTD's Catherine Nguyen has the details.
A new study by European researchers found 3 different types of the CCP virus spreading around the world. Microbiologist Sean Lin says this further confirmed scientists' belief that the virus is constantly mutating.
First, the SARS-CoV-2 virus did mutate aggressively in human body in different regions. Secondly, the virus may undergo further adaptation when it encounters different races in different continents.
Based on virus genomes from the earliest cases, the report traced the family tree of the virus from December to March across the world. Among the 3 types found, A, B, and C, the most common found in the U.S. was the original virus, type A. Wuhan, the original epicenter, was mainly hit with type B, an early mutation of type A. And type C, daughter of B, got into Europe via Singapore. Lin says this research also proves all cases linked to Wuhan.
These report clearly suggesting that all these cases can be tracked back to Wuhan, China, and the Chinese communist regimes claiming or blaming the United States or Italian as a source of or the origin of the outbreak. Those kind of claims are totally groundless.
Mount Sinai conducted another study, published this week. It suggests the virus in New York was brought there by people arriving from Europe. It also shows a case of the virus in Washington state came from Wuhan, which agrees with the study mentioned earlier. Reporting by Catherine Nguyen, NTD News.
And a group of scientists in Finland have created a virtual simulation. It shows that coughs are more effective at helping diseases travel than people previously thought. This 3D model provides insight into the trajectory of a cough. In the supermarket setting this model is based on, the particles of a cough can travel to over 9 feet into the air. The particles then move from one aisle to another. The model also shows that a cough can stay in the air for up to 6 minutes. And now we get to know Dr. Federico De Luca, an Italian medic that was infected with the CCP virus.
Dr. Federico De Luca is a 44-year-old geriatrician from Milan. He usually spends his time treating elderly people in a residential care home. Unfortunately, the father of 7 has now been taking care of himself after he was infected with the deadly virus. The virus hit him hard, forcing him to spend 3 weeks in intensive care, unconscious and connected to machines. But now he's able to sit upright again and tell the story of how the illness affected him. At first, he was aware that he may have contracted the disease when he developed a slight temperature, but he wasn't sure where he had picked it up. He wasn't prepared for how quickly the virus would take hold of his body. It was on the second day when the sickness really set in.
It was like I was falling out of control. It was like the ground just opened up under my feet and I was falling vertically toward the disease.
De Luca lives on the second floor and has no elevator. On the second day of his infection, he described being unable to walk down the stairs on his own. When the ambulance arrived, they had to move him with a stretcher.
It was a condition, let's say, of a continuous fall. My condition worsened so much that even my mind was unable to process the problem. If it had happened a week before, maybe my mind could have understood what was happening, but instead, my condition worsened so quickly that I was put on an oxygen mask and I was brought in as a red coat to the hospital of Sariate.
Fortunately, Dr. De Luca is now recovering. He no longer gasps for air and can almost breathe normally again. He says that before falling ill, his life was mostly divided between his work and family. He adds that he hopes to return home soon to his loved ones.
And there could be a reason you're snacking more than usual during the pandemic. Isolation can feel like hunger to the human brain. That's according to an initial report from researchers at the Massachusetts Institute of Technology. It's reportedly the first study in humans that shows how loneliness and hunger have the same signals in a part of the brain. Researchers say they found the human body's need to connect is as fundamental as our need to eat. And a scheme to tackle loneliness among elderly care home residents has gone viral amid the lockdown. Thousands of virtual volunteers are signing up to adopt a grandparent.
Liliana, that's a nice name.
At this care home, elderly residents are staying social while social distancing. They are using a virtual adopt a grandparent scheme that's helping to combat lockdown loneliness amongst its seniors. Volunteers can now chat online with care home residents as face-to-face visitors are banned due to UK social distancing measures. More than 62,000 people registered to take part in the initiative, organised by care group CHD Living, within just days of the launch. Among the volunteers is 5-year-old Freya from Gloucestershire, who has been matched with 74-year-old Sheila Warfield, a resident at a care home in Surrey.
This has cut me off from everything, this virus, because I've got 2 little nieces that live in Hazelmere, and they used to come regularly to see me, but they can't come now, you see, so I don't see any children, let alone grown-ups.
More than 30 residents at Sheila's home now have access to a Facebook portal device, as do the other 12 care homes the group runs in the south of England. Michelle Hustle volunteered to join the scheme after putting her business on hold for the lockdown.
And I think it goes both ways, keeping them company as well as keeping you company. And it just lifts, everyone's spirits, and it's a healthy and safe way to be able to bond and communicate with people who might not have another outlet.
CHD Living is now hoping to share those volunteers with partner organisations.
Up next, an emergency notice posted on social media says China's Sichuan province plans to add 52,000 quarantine rooms. That and more after the break.
They were working on developing a coronavirus for the human host. Leads you to question, why would you be creating a coronavirus that can infect humans?
That means virus now can infect human cells much easier.
I noticed that after the outbreak, the Wuhan Institute of Virology kept strangely quiet. Who is the real boss of the P4 laboratory?
I believe they're developing them. I think they want to be the most advanced nation on Earth when it comes to biological weapons.
We want the truth.
It's time for the United States to defend itself. The real disease here is communism.
what was the Chinese Communist Party trying to hide?
Welcome back. Rising tensions between the World Health Organization and Taiwan. Now politicians are calling for Taiwan's inclusion in the organization. NTD's Tiffany Meyer brings us more.
Could there be a second outbreak in China? A document circulating online says one Chinese province plans to convert 52,000 rooms into quarantine spaces. The emergency notice appears to be from the Virus Outbreak Emergency Management Office in Sichuan. It asks different regions to identify hotels, vacation resorts, or other places which can be used for quarantine. The document says officials should be proactive and make sure the quarantine centers are ready to accept people for quarantine as soon as the need arises. The letter also comes with attached files assigning quotas for different regions, with 52,000 rooms in total. It also asks officials to submit a count of potential selections to a contact called Hu Yingfeng within 2 days. 127 European politicians are calling for Taiwan to be admitted to the World Health Organization amid the global pandemic. That's according to a statement by the country's Ministry of Foreign Affairs on Saturday. 67 members of the European Parliament sent a joint letter to the EU on the 8th, and 60 members from the German Parliament sent a letter to the WHO on the 2nd. All 127 praised the way Taiwan handled the pandemic. Anita Schaefer, member of the Bundestag, wrote she can't understand how Taiwan has been left out, calling it a matter of life and death. Many are wondering about a vaccine. Professor of vaccinology at Oxford University, Sarah Gilbert, told The Times a vaccine could be ready as early as September, and she's 80% confident it will work. Experts say vaccines typically take years to develop, many estimating one for the coronavirus will take at least 12 to 18 months. But Gilbert says her team is one of the most advanced in Britain, adding human trials could start in the next 2 weeks. Other countries, including the U.S. and Israel, are also reporting progress. Israeli saying it could have one available for use within 90 days.
And in China's northernmost province, the Chinese regime is preparing for a second wave of infections. Our reporter Sherwin Rong has the story.
The epidemic in northernmost China, Heilongjiang province, has worsened. New cases of CCP virus keep appearing throughout the province. Authorities say they're preparing more than 4,000 hospital beds. Neighborhood community staff members in Heilongjiang's capital urging residents to stay home, saying asymptomatic infections had been found.
Everyone, please send this notice to residents. Asymptomatic cases are scarier. Don't go out. Stay at home. Seniors, don't gather in the yard anymore.
Official reports said the cases were imported from overseas, but residents said it's just an excuse.
Even if they're local infections, they will say they're imported, because saying they are local cases is saying they don't have the epidemic under control.
One city resident saying there are infections in neighboring cities too.
Our epidemic is quite serious, and there are new cases in Wuchang City. The community is still on lockdown. You have to wear a mask when you go out, and you have to scan your health code when you enter the community. There are also limits on when you can leave the community, 6 a.m. to 10 p.m.
Deng told us on April 9th that a week before, her community had discovered more cases of virus infection while scanning people's temperatures. Yu said the province's outbreak is quite severe.
Qikihar City also has several cases. There were more than 20 cases in a nursing home there, but they only reported a dozen cases. The local officials are hiding the full extent. The truth has not been reported.
I don't dare to ask. Otherwise, they'll think you don't trust the regime. I feel the information we're getting is not transparent.
They both said the real cases near the capital are hard to count, and officials in surrounding cities have started strengthening control measures. Reporting by Ru Yi and Shiwen Rong, NTD News.
Coming up, Costume makers from hit TV shows are helping to make scrubs for hospital workers in the UK. More on that after the break.
90% of news outlets in the United States are controlled by 6 corporations. They're not out to tell you the truth of what's happening. They're out to tell you the picture of the world that they represent. The mission of the Epoch Times is to chase the truth, to ground all statements in facts, and prevent people from being misled. This is a battle between truth and deceit. Subscribe today and join the Americans who are seeking truth and tradition. We'd love to have you on board.
Are you tired of newspapers spinning the truth and pushing false narratives? And are you looking for honest coverage of Spygate, the true story of collusion? Or the truth behind the crisis at our southern border? Or how the Chinese Communist Party is working to subvert America and our way of life? Then you need to check out the Epoch Times newspaper. It's independent, nonpartisan, and it doesn't push any political agendas. Just go to readepoch.com and try it yourself for a full month for just $1. You'll absolutely love it.
Welcome back. Professional costume makers in Britain are now using their talents to supply medical workers with hospital scrubs to fight the CCP virus outbreak.
Costume makers in Britain, who normally dress actors from Downton Abbey to Game of Thrones and Batman, have joined forces to make scrubs for medics on the front line of the CCP virus battle in the UK. Working from kitchens, sheds, and attics across the country, the team are churning out the colorful uniforms for returning medics and those clinicians who don't normally wear them. A costume maker for BBC and the HBO TV show His Dark Materials leads the effort, playing on the initials for the show.
I think partly why it took off like a rocket was I called our campaign Helping Dress Medics, as partly sort of a joke on being HDM, because we'd been known as HDM for 2 years as His Dark Materials. So everything's referred to as HDM. So I thought I'm going to call it Helping Dress Medics because it's what we all were working on, and also it might mean that we can grab some of the fan base to help us pay for it.
Dulcie Scott is helping lead the effort alongside a material buyer who once worked on a medical drama. Now, some 150 costume makers across the UK are producing the garments, including those who previously worked on such shows as Star Wars, Outlander, and Doctor Who. The costume makers take pride in their scrubs designs, just like their designs for TV costumes.
It's lovely because everyone's swapping pictures of what they're doing, and then I'm kind of tooting everyone's trumpet a bit about going, this is Jane Law, for instance. She's just made these set of scrubs, and she also made the wedding dress for Lady Mary on Downton Abbey. Boom. Things like that.
Scott said the group collects donations since all of her costume-making friends are out of work right now. She hopes fans of the TV shows can donate.
I mean, they're going out there risking their lives and saving our lives, and they are so grateful to us for providing the scrubs. And you're just thinking, well, it's a necessity. It shouldn't be a luxury. It's what you need.
Scott and her team are now cheered on by the actors and writers they once dressed.
And for Easter, pastry chefs in Europe are celebrating with medical-themed creations.
Easter Sunday is right around the corner, and pastry shops in Europe are coming up with different ideas for their edible creations in response to the virus. Here at this Greek confectionery, an army of Dr. Bunnies are being forged to help lessen the burden on hospitals. Well, that's not the real reason.
We made these bunnies first of all to honor our doctors.
The chocolate bunnies are fully equipped with surgical face masks and gloves. Another variation of the masked bunny is also being created in France. The simple face mask pays homage on a slightly larger scale.
I'm thinking of people such as medical workers and all the others, like the policemen, the firemen, workers growing and selling food, who are not used to working while wearing masks, and who are especially not used to spending the holidays with their loved ones during a difficult period.
But while these two chefs make virus-themed goods, this pastry chef in Belgium decided to take a different route by sticking to the classic Easter bunny motif.
I didn't want to play the coronavirus card. I know some have done so. I did not want to play on it because it is already depressing enough the way it is. I wanted to have something much more festive, something nice, perky, and colorful in my collection.
Whether it's bunnies with medical equipment or traditional Easter decorations, we can only hope that all of these sugary treats can bring smiles to the faces of those who buy them.
And still to come, zoos in Latin America witness the wonder of life, despite hardships brought on by the virus. Several baby animals have become new additions to their respective zoos. That and more after the break. Welcome back. A Chicago aquarium is sharing their penguin enclosure online. This season, they're finding their partners and materials for nesting. The colony at Shed Aquarium is made up of magaletic and rockhopper penguins. They'll use lavender sprigs, fig branches, and grapevine pebbles to make their nests. Last year's season produced 2 new additions to the colony, named Calista and Carmen. And in Latin America, zoos are met with good news as healthy babies from various species are born. Despite financial challenges amid the pandemic, zookeepers are determined to care for their animals.
While the world is dealing with the harrowing reality of death caused by the CCP virus, zoos in Latin America are witnessing the wonder of life. In a small zoo in Colombia, a set of twin cotton-top tamarins were delivered. Social media users suggested names like COVID and Cuarentena, the Spanish word for quarantine. And in Lima, the Park Legends Zoo has many new members, including 2 baby pygmy marmosets and a vicuña. Although these zoos are experiencing financial problems without any visitors, all the newborns are happy and healthy.
For many of them, we're committed to the maintenance of animals. We have trained personnel and personnel that in the current situation have been developing and doing activities for the welfare of our animals.
Most births take place during the first 3 months of the year, when the weather is warmer and before the start of the rainy season. For the keepers, the births come as positive news in the middle of the CCP virus pandemic.
With the current situation we're going through as a country, the park also fills us with satisfaction, the result of a lot of work, which are the births.
The zoo also takes in animals rescued from illegal animal trafficking. Currently, the zoo is asking for donations so it can buy meat to keep feeding its animals.
That's all for today's news. Thanks for tuning in. I'm Paul Graney.